everyone. Welcome to the interview panel for Med Mentors. My name is Sophie and I will be moderating today. If our panelists could please introduce themselves, just with your name, where you went to college, when you interviewed, and what year you are in medical school, or any other fun fact we'd like to have. Also, sorry if there's animal noises in the background. I'm pet sitting today.
Sure, I can go first. Hi, everyone. My name's Matthew. I'm a third year, I guess. We're just finishing up our clinical year actually this week. Part of the CDU UCLA medical education program. I went to undergrad. I did 2 years at Hopkins and I transferred and then did 2 years at UCLA. And now I'm here and I took one gap year and then I applied during like the first COVID cycle. So I had all my interviews like virtually. So that was my experience.
Hi, I'm Haiti. I'm a first year medical student. I just started, so I did the whole interview process not too long ago. I went to UCLA for undergrad. I took one gap year. I graduated in 2022. And yeah, so all my interviews were also online. I don't know how it's going to be this year. I don't know if anyone else knows, but yeah.
Awesome. Cool. Two Bruins in the house. All right. So kind of how we're going to structure the panel today is kind of to talk about things to do to prepare for interviews, and then kind of talk about how the interviews kind of roll out, and then kind of if you need to do anything after. So the first question that I have for you is, what are common types of interviews for medical school? What are some less common types that you encounter? And yeah, I guess you guys both answer this, but were your interviews in person or online?
Sure, I can start. So interviewed online, like I said, the two main interview types that I had were MMIs, which are multiple mini interviews, where you have like multiple stations in like one day and you answer some sort of question, or they give you a situation that you have to respond to, or sometimes there could even be like acting involved, but I think less so now that things are virtual. Um, and then traditional interviews, which are like the one-on-one interviews that you have with like a professor or a MD or like a med student. And then the other type of interview that I saw, the only other type was like a group interview. And for the group interview specifically that I did, it was we would have a scenario and we kind of had to work through the scenario together. And that kind of helped them gauge how we would like work together as like med students and what qualities we had.
Yeah, if I can add on to that, I think the other thing, those are the three main types I saw also, but the other thing is for each of those types, depending on the school, it can be an open or a closed interview, which means like if it's an open interview, that means your interviewer has seen your AMCAS application and all your secondaries. If it's closed, then they know nothing about you or the rest of your application. So I think it's important to know which type of interview you're going into before you start.
Both very, very good answers. Another question that kind of came up pretty frequently in the RSVP form is, how do you even prepare for interviews? Did you use a mock interview service? Did you practice with family and friends? Did you just talk in the mirror? What were the things that you found most helpful?
I didn't use a mock interview service. I practiced like with myself a lot, which sounds weird, but it was really helpful because I didn't feel like anyone was judging me. And then I practiced with family and friends who like knew me well, and so they would give me pretty good feedback based off of like the type of person they know I am. I see a question in like the Q&A thing, what resources do you recommend? I used a book that I bought on Amazon. I totally forgot what it was called, but I can look for it and send the link. And that was pretty helpful because I had no idea what to expect in terms of like what questions they were going to ask. And they hit the nail on the head. They kind of really gave the good ones to practice. So yeah, I would just practice with myself and write things down, like little bullet points, and then the more you do it, the easier it becomes.
Yeah. Practice, I think, is the most important part. Finding like free resources is super duper helpful because there's a lot of free resources on the line. You can go to like Reddit, or even different like test prep companies have like examples of questions that you might be asked. I also worked with like a mentor that I had from medical school, or from undergrad, through like a medical student association that org that I was a part of had connections with. So I used I had him like help me practice. And then I also went to like pre-health conferences, because some of them actually have like free MMIs that you can do. And I think the book, I'm guessing the one that you were talking about, is like MMI, like winning strategies, something like that. Um, I've heard of it. I didn't use it, but I've heard it's a really good resource. And just practicing, even if you're practicing by yourself and like recording yourself, I think that can be good as well.
Yeah, I agree. I think that practicing is really useful, but I would also kind of caution against memorizing answers. So kind of how Heidi was mentioning, to actually, do bullet points, take note of how you would answer, and in case you get stuck, but really try and remain authentic to who you are and not really memorize every single sentence that you're going to say in an answer. I think would be really helpful. Sorry, I'm just checking. Oh, this is another really good one. How do you reduce stress before interviews?
I think a big part of like this is just making sure to like affirm yourself, and realizing like once you get to an interview, like that's already a really good sign. Like they obviously liked you on paper, and they just want to see that you are who you say you are on paper in person. So I think having like that mindset helped me. I also, before every interview, would like put a little song on before every interview that like would hype me up and like remind me and like stay grounded, help me stay grounded. And I think that was very, very helpful as well. And then, of course, I think practicing kind of helps. Like similar like to like the MCAT, I feel like practicing how like the MCAT was like with practice tests helped me be in like a calm place when I actually like took the MCAT. So similarly, practicing interviews, I think, helped me as well.
Yeah, I agree. I didn't really do any like specific practices to calm myself down before, but I would go into an interview more confident and less nervous if I knew the situation I was going to be in. So I would try to do as much research as I possibly could beforehand. Like a lot of schools will give you the names of the people who will be interviewing you, so you can look them up and try to find out some stuff about them. And that makes it less intimidating and also kind of helps guide what types of answers you should give based off of like what specialty they are, what they're interested in. A lot of times they'll pair you with like someone who has similar interests as you, so it should make the conversation a little bit easier, and that's really reassuring. Um, but yeah, other than that, just like knowing what type of interview, like open, closed, is it traditional, how many people are you interviewing with, stuff like that.
All very good points. Another question that they have are, what are some questions that come up frequently during your interviews, things that you should kind of prepare for or kind of have in mind that it should come up during your interviews?
Tell me about yourself. That was like, I got asked that in every single interview that I had. And that one, I think it's important. That one's really hard, was really hard for me to answer at first because there were so many things that I wanted to say, but you have to keep your answer kind of short. So I tried to say like more non-medical things about myself, like more personal things about myself, and then that led into conversation naturally. Like about my medical interest, because a lot of like your personal self can lead into why you want to be a doctor, which is a good way to like get to know your interviewer and make it less sterile, if that makes sense. Yeah, that was like the massive one. Every single person asked me that.
I think the other really common question is like, why medicine? Which the way I approached that question was similarly to how I like answered it on my personal statement, and just like telling the story of how I got into like what made me interested in medicine to how I developed that interest in medicine. Another one that can sometimes be uncomfortable to answer is like, tell me about a time when you had like a conflict with someone, or you saw someone do something unethical and how you responded to that situation. So that one I remember came up very often, and so I made sure to have something like in mind that I kind of could tell a story about.
I think the other thing too for that question you mentioned about like why medicine, a lot of people try to approach the answer as in like why do you want to be a physician and why don't you want to be a nurse or a PA or someone else in the medical field, because the line kind of gets blurred for some people's answers. And I've heard it come up for some people who didn't specify like why specifically do you want to go to medical school. The interviewer afterwards will ask like, well, based on that answer, why don't you want to be a nurse? Or based on that answer, why don't you want to be a PA or someone else in the healthcare field? And that can kind of stump you if you aren't ready to say why specifically doctor.
Yeah, I will say another type of interview that I've had that was unexpected was just people looking at your file and then telling you to ask them questions for half an hour or for 20 minutes. And it can be very daunting to do so. So being able to kind of, how our panelists said, kind of have those teasers on the tell me about yourself question can kind of help fill in that time and get you kind of have a personal relationship before you start asking those questions. So those questions don't have to be as sterile as well. Kind of going off of just what you guys were saying was, are interviewers typically nice? How have you found that your interviewers and your interactions went during your interviews?
I think for the most part, most of them were nice. I feel like there are sometimes in either in a like MMI station or like in a question, they might be like very oppositional, but that's kind of part of like the interview, making sure that you don't like waver in your opinion once there's like a little bit of pushback. But I think for the most part, most of them were very, very nice.
Yeah, I agree. I think at the MMIs, it was a little bit more susceptible to them being a little bit pushy because they can like want to challenge you in the short amount of time they have with you. But for every other interview, I like really enjoyed my conversation.
Yeah, that sounds like all good points. And I'm glad that you guys had nice interviewers. Sometimes it can be daunting. Another question, just in terms of preparation for interviews. Sorry if this seems disorganized. You guys are answering them very efficiently, and I'm very much appreciative. What should I wear and what should I bring to the interview? Either in person or online, whichever one you think is suitable.
I'm guessing most interviews are probably going to be online. At least I'm hopeful, just because I think it's more equitable that way. But in terms of what to wear, like business professional is fine. And then just, I think the other aspect, especially for like virtual interviews, is making sure that you don't have a like background that's too distracting, and that you make sure that you're in a quiet place where like no one will like interrupt you or like come in and out, just because that can be distracting both for yourself and for the interviewer. So like we were in like lockdown when all my interviews happened, so I had to like tell my like family like, hey, I'm gonna have like an interview, like make sure to be quiet. Yeah.
Yeah. Yeah, just make sure you're in a quiet place. If you're on Zoom, I mean, I wore like sweats on like sweatpants and then like a nice a blazer and whatnot, and like I don't know, just look presentable. Don't look like you just rolled out of bed.
Yeah, good point. Also double check when your interviews are and be ready a couple minutes beforehand. Because technical difficulties do happen, and it's always best when you have the time to prep for that.
And make sure to check the time zone as well.
Yep. And then even before that, make sure that when you get an email inviting you to the interview, that you confirm that you're able to attend the interview on time. But you guys are here on a Zoom call, so you guys all know how to do that. A couple questions for during the interview. And we've mentioned MMIs a couple of times, but I don't think that that's a very normal type of interview scheme outside of medicine. Would you guys mind sharing a little bit more of what that looks like?
So, oh, sorry.
No, go.
Okay. So the MMI, the way it looks like, depends also on the school. I had one school where we had both MMI, a traditional interview, and a like group interview all in one day. And then there is one school or one program that had like a 12 station MMI that we had to like do. And the way it kind of works is you're like in a like Zoom room with another person and they ask you a question. They like put up a question on the screen and then you can read it and then you'll have time to think of a response. So you can like jot down notes and things to think about like what you want to say. And then you'll have a little bit of time to respond to the question. And then they might ask you questions after your response, depending on what's going on.
I think that's a very thorough answer. One thing to keep in mind as well is some schools, if they are closed for MMIs to keep things unbiased, this was something I wasn't expecting, would tell you not to mention anything personal. So you weren't allowed to say what school you went to or any sort of identifiable comments. Which was a little different for me. Also, our third panelist was able to make it tonight. Holly, do you mind introducing yourself, kind of where you're from, what year you are, how you interviewed, stuff like that?
Yeah, for sure. Hi, everyone. My name is Holly. I'm a fourth year medical student. When I did interview, they were all in person, but I'm happy to provide that perspective as well. And I am currently applying into internal medicine residency programs. So going to be on the interview trail real soon along with you guys. But maybe I can talk a little bit about MMIs as well. So for context, MMI stand for multiple mini interviews. So the like brief context is that you would get maybe a minute or two to read a scenario, and you'll have the remainder of the time, usually maybe 7 minutes, to just fill that space up. Some, depending on the interviewers, are interactive with you and would, if you after you finish your spiel, they'll keep asking you questions and discuss that topic. Other times, once you finish your initial answer, that's kind of the end of the MMI. And I think if I remember correctly, there's generally 3 types of MMI questions. One is kind of ethical scenario type questions. One is more like your character development and the experiences you've had to inform different qualities that you have. And then the last is some sort of teamwork thing where you might have to interact with other attendees to show how you're able to work with other people. And I think the key to those is, especially for the ethical scenario questions, which initially intimidated me, was that just do your best to acknowledge both sides of the ethical dilemma, acknowledge that it is a dilemma, that's why they're asking you, and then just do your best choosing a side that and support that side that you're choosing.
Thank you so much for that insight. It's true. Remaining impartial is really important during those ethical questions. A couple of questions kind of to get a little bit more insight into your guys' personal experiences is, can you guys tell me about a great interview you had and one particular made it really good? Or if you'd rather, you can share the opposite. Tell me about an interview that didn't go so well and kind of why didn't it go so well, or how did you recover from it? Holly, do you want to go first? Oh, never mind.
Go ahead, go ahead.
Okay. One thing for me that went really, it wasn't really necessarily the entire interview, but one thing that went really well for me at the end, when they give you like, some schools give you like 15 minutes to ask questions, which is kind of long, but that's, to me, was an opportunity to like present stuff about myself that I wasn't able to talk about in the interview naturally, like based off of the questions that they asked me. So like, I remember there was one interview that I had, and a huge part of my application to med school and like why I wanted to go to medical school was because I was at a free clinic for 8 years, and it was like my main thing. Like that was my most meaningful experience. I wrote about it in my personal statement, but none of the questions that this interviewer asked me like led into me talking about that. And I really wanted to bring it up at the end. So when you like ask a question, you can bring up things that you feel like you missed or that you feel like are really important to who you are by like prefacing a question with, well, I had this experience and it was really important to me, and this is why it was important to me. And I'm wondering if at your school there's any way that I would be able to get a similar experience, or like there's a way, I don't know if that makes sense. So to me, what went really well is like using that time at the end to ask a really meaningful question, but also introduce something new about yourself that you feel like is important. So it's not just wasted time.
I think one of the best interviews that I had was actually one of my first interviews, and it was a traditional interview. And I feel like traditional interviews kind of lend themselves more to being able to like show a little bit more about yourself, because MMIs, you kind of just have to be a little bit like quick on the answer. But I remember talking a lot about like the organization that I was in that had nothing to do with like medicine really. It was all about teaching like STEM to elementary school students and like telling them so I talked a lot about that experience, and it was something that I was like very passionate about, something that I was like a leader in, and something that I kind of had to develop from like the ground up. And so it was something like very important to like my pre-med journey, even though it wasn't something that was directly like tied to medicine. And I think having those things that you're passionate about can make an interview go really, really well.
Yeah, all good perspectives. I think for me, it was kind of ironic. I remember during one of my UCLA traditional interviews, I felt like the interview didn't go well because I felt like I didn't have a lot of opportunity to talk about myself. And we mostly talked about like topics like, physician burnout. We talked about a lot about the interviewers, like family and like her experiences with burnout and stuff. So I felt like I was listening to her a lot more than actually talking and contributing and showcasing myself as an applicant. But it turned out it turned out to be not the case since I'm here now. So I think definitely your assessment of how interviews go, especially if you think you did poorly, more often than not, that isn't the case. As long as you are conversing, as normally as you can, the interview process is just meant to gauge how personable you are. So you don't necessarily have to feel that pressure to have to regurgitate your CV or show how amazing you are.
Yeah, I agree. Just being able to have a conversation, I feel like sometimes feels like a big win during interviews instead of feeling like you're just regurgitating everything. Kind of along those lines, a lot of people in the RSVP form asked, like, how do you answer the why this school question during interviews? What are some things that you would recommend, and what are some things that you might avoid?
Okay, I'll go. I think a big part, this is the same like strategy that I had in terms of like secondaries, whenever secondaries like asked me, I would make sure to do my research on the school, figure out like, is there something that like drew me to apply to this school in terms of like curriculum, any orgs that they're part of, anything that kind of aligns with what I did as a pre-med that I could do as a med student, and then kind of like talk about like those things. For me, something that was very, very important was like working with Latino communities. And so I always talked about how I want to like continue doing that work that I've done in the past as a pre-med, and continue like having a community with, so I chose a lot of schools with like an established LMSA chapter, and that have like hospital systems that work with the Latino community. For example, UCLA partners with like Harbor UCLA and All of You, which are both very heavily Latino communities. And so I talked about like those kinds of like specific things that you wouldn't necessarily like figure out just by like glancing at the homepage.
I think you also like you don't need to keep it medicine specific. A lot of answers that I gave on why this school were based off of my research into the city. So like for example, I'm a dancer and that's like a really big part of my life, and I wanted to make sure that I would be in a place where that would still be possible for me as a student. And like obviously LA has a huge dance culture, and so I am able to find ways to like continue that passion because of this city and the way that I'm able to do that here. And you can like if you want to, you can even go so specific as to like look for dance studios in the area. What I did was like look for dance studios in the area. I actually got a question about that at one school, and they were like, well, did you look into anywhere around here where you'd be able to do that? And I like had an answer, and it was, I felt very proud about that one. So you can get as specific as you want to, and it doesn't need to be like necessarily super medicine based. There are other reasons too to want to go to a school.
That reminds me, I think I read somewhere someone really liked a school's proximity to a Costco or something, and that's the kind of their metric for why certain schools. If I remember correctly, I think most schools don't, especially the big schools that a lot of applicants apply to each year, usually don't ask these types of questions. Usually the smaller schools or very mission specific or mission focused schools would ask those questions. And I think if you feel like that the school would be the case, then definitely prepare an answer for it. I think the only time I was asked that question was interviewing for a smaller school in New York, where I have zero connections or ties to. Like I have, like, you know, everything, all the education I've done was on the West Coast, and so they were just asking like, why would you come to Long Island? And I like, you know, had to have some sort of answer for that. So definitely be prepared for answering that sort of geography questions. But otherwise, I don't think that was actually a question that came up too often during their interview trial for me.
Yeah, I agree. It was oftentimes when I was interviewing at a place that was very far away from where I was that they really wanted to know, did I have any reasons to choose it over a place that was close to home? Or if I'd moved, because I moved away from home, they were kind of asking, would you be willing to come back? And so I think that that's a big part of it. I would really try and stay on like the positive side and emphasizing the positives of the school that is asking that question, and really emphasizing all of the positives in any opportunity that you did have, just so that like you leave a positive image of yourself and kind of a positive view in the interviewer's eyes, right? Because you're going to think so much better of somebody if you're like, oh yeah, I really liked living in a city, versus I really don't like living in the countryside, so your school would be better, right? Like there's positive ways to spin a lot of things that do make it sound better. Sorry, I'm just trying to make sure I answer all of your guys' questions who are attending. If you guys are missing any questions that you really want answered, just feel free to put them in the Q&A. We're answering them as they come in if you have not seen that. what are common mistakes students make during medical school interviews? How do you avoid them?
I think one mistake is forgetting to introduce yourself. A lot of people get nervous and then they kind of just like don't say hi or don't say like, oh, my name is, and like, I don't know, ask them how their day is going because they're a person too. And they're taking time out of their day to interview you. So it's should be fun for them too.
I think another thing is know your application well. So know, every single thing that you've listed and written on your application, so that anything they can ask is fair game, even the smallest, tiniest detail on your application, and be able to speak to them, with some sort of passion and enthusiasm and understanding. So if you have, let's say, research experiences from like years ago, if you're putting it on the application, definitely spend some time to refamiliarize yourself with it in case it does happen. On the contrary, I think another thing is to not feel the need to have to rehash your entire CV, as I alluded to earlier. By the time they have selected you for interview, you've already passed their assessment of your amazingness, and they just need to make sure that you're a normal human being who can have a conversation with another human being. So with that in mind, like definitely just kind of go with the flow of the conversation and engage with the interviewer as if you're having a conversation.
Another mistake is kind of just like stating things rather than like showing things, kind of in the similar vein with your like personal statement and like secondaries. Because I think saying like, oh, I want to work with underserved communities can sometimes seem like ingenuine if you don't show that you've had experiences that like kind of show that you're interested in doing that. So making sure you kind of explain some of the responses that you have.
Yeah, I agree with that. I think that's actually important. So if you are not someone who, regularly thinks about certain things and how different experiences influence you to want to do XYZ things, I think it would be helpful as you're preparing for interviews to just reflect a little bit and think about, which number of experiences, made you want to, like, i.e., like work with the underserved communities, which experiences, have changed you as a person to make you more resilient, and just having kind of a bank of experiences to pull from, because I think, when you're making statements, it's always much more powerful if you're able to give examples to back the statements up.
Yeah, there's a structure, I think it's called STAR or something, for responding to interviews. If you look it up, you'll see it. And it's very much about how to incorporate these sort of examples and these allegories into your answer, which in some instances can kind of help support the fact that you know what you're talking about, or that you have some frame of reference, and can also help guide the conversation into a more natural side conversation, kind of how everybody was saying. But yeah, I would definitely kind of think about different experiences and how they can answer different interview prompts, and kind of be able to pull them out just with bullet points, kind of how Heidi was mentioning at the beginning of the call. Having those bullet points in your head can really help you, even if you have a challenging question. Kind of building off of that, it disappeared, but how do you guys handle curveball questions in interviews? Like questions that you didn't even think were going to come up, or that you have no context in terms of what they're asking. How do you navigate that?
I think I wrote a little response, but I think the biggest, most important thing is if you don't like, if something doesn't immediately like come up, like it's okay to say like, hey, I need a minute to think about this. Or like if you're unsure about like what they're asking, ask a little like a follow-up question like, hey, what do you mean by this? just so that you have all the information, and it's okay to like take time to answer. I think that's actually kind of a strength rather than just not saying anything and then like leaving silence. So verbally like ask like, oh, I need some time to like think about this response.
I think it's also okay to say that you don't know something. Like it's better to say you don't know than to come up with something random and hope for the best. Also something that I didn't know before I started interviewing was if they ask you like an ethical question, specifically one that's like in a hospital setting where it's like a common one that I had was like, who should get the organ or something. You can like remember that there are committees within the hospital that are like trained to deal with that kind of stuff. And it's important that you can call in like ethical committees to talk to you about patients and like expressing that and like that kind of shows that you're team oriented and you know that like not all the responsibility falls on you, and it's important to have those conversations with other like members of the team, including the patient, patient's families, ethical committees, and all that stuff.
Yeah, both really good answers. And I think I'll add on the last thing is to just stay calm and recognize that maybe these interviews are meant to be intentionally stressful. There are a style of interview that I think I've experienced one time that was intentionally stressful to see how you would react in a stressful situation, which I don't know if it's very necessary, but you know, just stay calm, be honest with yourself and be honest with the interviewer. And I think that'll take you far.
All very, very good points that I could have used. Another question that we got from the RSVP form is, how do you condense your answers to be condense your answers to questions to fit within the allotted times? Or kind of on the flip side, if you were on the opposite side, how do you fill in time when you feel like you've answered the question completely?
This is one that I really struggled with, especially with closed interviews where they don't see your file and then they ask you a question about something and you want to describe an experience, but I felt like I had to like describe what I did first before I could get into anything like personal about that experience. And so my advice for that and what I did before to prepare for interviews was like not memorize, but like practice a very short blurb describing each experience so that when you do get asked something and you want to talk about the specific experience, you have like a 2-sentence explanation of what you did in that role before leading into why it was important to you or like how that answers the question. And that way you're not like rambling on about things that you're passionate about when you don't really need to be rambling about those things, if that makes sense.
Yeah, so most interviews, especially the traditional style interviews, it's very much like a conversation. So you shouldn't feel the need to have to fill in time because as soon as you finish answering a question, you'll get asked another question. But for MMIs, especially if they have a rule of not engaging with you and asking follow-up questions, if you do know that is the case, then when you are saying your answer, be very intentional about the planning of it and take your time to go into each component. So let's say if this is an ethical scenario MMI question, then first you can restate the question and restate your understanding of the scenario and have a systematic approach to like why, arguments for one side, arguments for another side, and then go into synthesizing each side and providing your support for what you think ultimately is the right choice. So having a system can help you make sure to address all the points in a very logical, easy to follow way that can fill majority of the time.
Very helpful. Sorry, I'm trying to, there's so many questions to ask. I guess another one just to reiterate is a lot of questions come up about ethics questions and kind of how to navigate those. Do you have any like specific pearls for those ethical questions? I think Holly mentioned like to kind of keep both sides into account and not to take too strong of a position, but do you guys have other suggestions?
My big thing was always just calling in a third party if I didn't know what to do, because you have that option in real life too. And yeah, I just think it's better to consult other people than come up with a uneducated answer on your own. And then I know they're really stressful. I always got really stressed out by these ones too. And there were a couple where I didn't know how to answer them, and I just said, I don't know. And you're not expected to like have any medical knowledge yet, especially like for the medical based ethical questions. And you can always just say like, this is something I'm really excited to learn about in medical school, and like gain the knowledge to make educated answers to these types of situations.
I think knowing like the basic principles of like bioethics, like autonomy, and like those kinds of things would be a good idea just to like look up so that you're familiar with those kinds of things. I took like a biomedical ethics class, which was one of my favorite classes in undergrad. So definitely, if you have the opportunity to take like a class like that, take it. And then just like make sure that you talk about like both sides, like the pros and cons of both situations. And then just talk about why you feel like this this way of going is better than the other way of going.
All good points. Kind of Bill, I think, sorry, I'm just making sure to answer everything a little bit more in detail. Do you guys have any particular tips in terms of how to answer the tell me about yourself question? I know talking to family members, kind of figuring out what's important to you are all important, but like it seems so like such a daunting question to get asked at the beginning, that hearing your guys' insights would be helpful, I think.
I would just say talk about things that you want to talk about and you want your interviewer to ask you questions about. So don't like mention something where if your interviewer asks you a question about that, you're not going to have a meaningful answer to it, I guess. And then also just like remember that it's kind of like what Holly's been saying, like it's not supposed to be a list of your resume and like all of your experiences. It's supposed to be more about like your life, and what you're passionate about within and outside of medicine. And yeah, like don't feel like you need to answer a specific question. Just talk about stuff that you'll want to talk about further.
Yeah, I think it is a difficult question and one that is actually worth your time preparing a decent response for, because that is how people start an interview, especially for the traditional interviews. I think the typical things of, saying where you're from and things like that, can always it can always be a good starter point. And like Heidi mentioned, definitely if you do want to highlight certain activities you're passionate about, you can do that, but be prepared to talk about them more in depth. This is kind of the starting ground for that'll kind of dictate the trajectory of the rest of your conversations. So if you feel like just kind of sussing out the vibes of the school, it's a very casual setting, then you can actually not mention too many of your activities and instead like focus on other things you're passionate about, hobbies you want to talk about, especially interesting hobbies. Those usually get people's attention, so that for the rest of the interview, maybe you can just talk about your hobby and bond over with the interviewer that way. Kind of use this as an opportunity to find common grounds and interesting talking points to, reach the interviewer.
Oh, good points. Matthew, do you want to add anything?
I don't think so.
Okay, cool. So I think we're gonna get pretty close to wrapping it up. If you guys have any questions you really want us to ask, again, Q&A. But the last question kind of pertains to post-interview communication, like thank you notes. What are your guys' views on that? Do you guys have any recommendations?
I think follow what the school tells you. That's always the best advice. If they allow for like update letters or like letters of interest, like that's definitely something to think about. And then in terms of like thank you letters, I don't think they're necessary. Like I didn't do any thank you letters at all, and I got accepted to like a good amount of places. So like don't feel pressured into feeling like you need to do this in order for you to get in.
Yeah, so if a school tells you, the rule of thumb, I think I went with, if the school tells you not to reach out to them, do not reach out to them. And then otherwise, if they say you may reach out to them, I would reach out to them. So if they say you may send a letter of interest, then it will be a difference. It'll make a difference whether you send out a letter of interest or not. So unless they tell you explicitly not to, it doesn't hurt to send a letter of interest, especially if you're very interested in attending that school.
Yeah, and in terms of structuring your letter, if you are going to write a thank you letter to your interviewer, I would just like bring up important points from your interview that you thought highlighted kind of what you wanted to bring across during your interview, and then say specific things about the school that like align with those. You can introduce new stuff too if you want to, but I would like make it mostly school specific and yeah, and then also like say thank you and for their time and all that.
Also, I want to say like the other thing that you can do, which this is like is a letter of intent, but that's like you can't send a letter of intent to more than one school. Like it's really, really bad if you do. Which is basically saying like, oh, if you accept me, like let's say you're on a wait list after an interview, like, oh, if you accept me, I will go. So don't send multiple letters of intent to like multiple places. But letters of interest, yeah, you can do multiple.
Yeah, and even if if you don't want to do like a formal letter of interest, you can always, if they accept update letters, you can always be like, I really enjoyed interviewing here because of X, Y, and Z, and these are the reasons why you really liked it. Here's a couple things to update. Really looking forward to learning more about your program, whatever, right? So you have degrees of intentionality that you can put in these update letters, in these letters of intent, in these letters of interest, that can really change the tone. But I have seen that like sending those post interview communications have correlated with what people got as results afterwards. But don't feel like if they didn't give you an email, or for like a student or somebody that's really hard to find, you don't feel like you need to go hunt down that email. Like it's perfectly fine to just send it to people that you can find online. All right. If you guys have any more questions, happy to stay on. Otherwise, I'm going to end the call. If something that we did at previous sessions is if the panelists feel comfortable, they can leave their email in the chat if anybody wants to reach out to them privately as well. But definitely another thing I want to advertise, since this is an interview panel, is that I think that Med Mentors is going to be hosting a mock interview later this month or in October. I don't know the exact date, but you can definitely look into that. But yeah, thank you so much for coming. And thank you so much for our panelists. I learned so much just listening to you guys. So.
Yeah, one more thing I wanted to give a plug for. No, it's just like resources and whatnot. I remember practicing interviews with Christina from the Career Center. And I thought that was very helpful. So if you are a student, or I think if you're within 1 year of graduation, you are still eligible for Career Center services, and you can schedule mock interviews. So definitely don't pass on that. And then my mentors, we also have mock interview sessions that you can sign up for.
I don't know how to put my email because the chat only goes to you guys.
Oh, hold on. Let me mess with that. Chat. You can change it to everybody, I think. Can you? Or is that only a me thing?
I
Stop
can't change it to
recording.
everyone.
Yeah, I can't either.
Okay, if you guys